For those who have experienced labor pain, so I think I had experienced before. It is a very excruciating pain and the most painful ever for any normal woman, all right, or any human being. It is very painful, excruciating. I can describe to you when the contraction is becoming getting stronger and stronger. It is just like a tearing of your womb. So it is a slight knife sharp pain. In general, in all hospitals, doctors can offer you either, most of the time, either injection or either by using gas, right? The gas is called Antenox. It's a combination of oxygen and nitrous oxide, 50% oxygen and 50% nitrous oxide. But that gas should be inhaled by yourself, by the patients who are in labor. All right, she should hold a mask on the face, and then it acts like putting you to sleep. All right, you go off, you doze for a while, then you just off your mask, and suddenly you wake up, you are in pain. It only can take away pain about 30% only. All right, the other treatment that we can give to relieve the pain during labor is by giving injection. So the injection that usually be given to the patients in labor is, for example, a strong opioid. All right, those injections like NSAIDs won't help because the labor pain is very severe, right? If we give IM petidine or IV petidine, those kind of opioids, it actually goes into your blood circulation, right? And you must remember it also goes into your baby circulation. And most of the time, if it is given 1 or half an hour before your baby coming out, your baby will have that side effects of this injection. So this injection will cause you to become drowsy, and it goes the same to your baby. So your baby will become flat, we call flat, meaning that no response at all, no breathing, and this we don't want that side effects to be happen. So the most currently nowadays the most effective and safe mode of to relieve pain during labor is by using epidural. Epidural is actually a kind of half-body anesthesia. All right, it is given at your back, in between your backbone, right? So we give a small jab at your back, and it goes inside about 3 to the most is 7 cm, right? Depending on your body size. The bigger you are, the higher you are, the deeper I'll have to go in. All right. So we stop before we enter the dura, meaning that before the spinal cord. All right. Then we inject medication there. It is local anesthetic, which took longer action than the one that we give for you for numbing injection. All right. So it acts as blocking actually the nerve impulse from lower half of your body, and your brain does not perceive any pain. All right. Bear in mind there is also failure rates of course, right? And it depends on the operator, it depends on the doctors who are doing it. All right. In general, it's about 5%, right? 5% failure rates. But if it does not work, we have to put it again. All right. When we give that epidural injection, first of all, we'll clean your back, all right, and then make a small jab, all right. So most of the patients will ask me, well, is it painful, doctor? Well, I want to tell you, if you ever have this IV drip, right, your hands have lots of nerve. So your hands is more sensitive, so that local anesthetic given at your back is lesser than this injection pain. All right, you will have a little bit of sting, and then that's it. All right. After the local anesthetic, then we'll prepare the epidural, needles, and catheter, everything. Then later, within 5 minutes, we do this epidural. Okay. After we have done, we will plaster the catheter at your back, and then we will give bolus dose of epidural drugs. All right, and then we put you lying down as usual, and then you feel like nothing at your back except you feel like some plaster there, some stretching of the plaster there only. Patient-controlled epidural analgesia is a special shrink pump that we give to the patients where you can control by yourself. So you don't need to call for the nurse, you don't need to call for the anesthetist every time you have pain. So the role of this shrink pump is that to be able for you to purge a little bit of the drugs when it is needed. All right, it is very safe in a way that that machine is programmed already. Okay, it has a safety mechanism. The most common side effects in epidural is that once we give your bolus dose for the initial period, you will have like cold feeling, you feel cold, a little bit of shivering, and sometimes nausea, sometimes vomiting. Once you opt for epidural, we always give you IV fluid. Because why? After we give the injection, it will vasodilate half of your body, and sometimes it causes your blood pressure to drop a little bit. So you have a feeling like if the blood pressure drops so much, you can have this feeling like drowsy, nausea, and sometimes you can vomit. All right. Okay. What I mean bolus is that for the initial period, for the epidural to work, we have to give some bolus. I mean, a bolus dose and then later for infusion. Without a bolus dose, epidural won't work. Okay, actually all mother in delivery process can have epidural. Okay, that's their own choice. But those patients with like medical problem, diabetic in pregnancy, hypertension in pregnancy, heart problem in pregnancy, previous cesarean section, previous difficult delivery, most of the time your obstetricians will advise you to take epidural.